What if the most dangerous mistake you're making for your health isn't what you eat, but what you ignore? Right now, inside your body, acids are constantly being produced. Every meal, every breath, every metabolic reaction pushes your internal chemistry slightly off balance. Most people never notice it until the damage accumulates. Baking soda is not a cure. It's not a trend. It's a chemical buffer, and when misunderstood, it can either support balance or quietly cause harm. This video is not about home remedies. It's about chemistry, about how the human body regulates acidity, and why disrupting that system without knowledge can backfire. Sodium bicarbonate works by neutralizing excess acid. That is a measurable chemical reaction, not an opinion. On the surface, it has been used for decades to calm irritated skin and reduce inflammation caused by acidic conditions. Internally, the stakes are higher. Research published in the Journal of the American Society of Nephrology shows that, in medically supervised cases, sodium bicarbonate has been used to manage acid buildup in people with chronic kidney disease. This does not make it safe for everyone, and it certainly does not make it harmless. Your body already fights aggressively to keep its pH within a narrow range. Interfere too much, or at the wrong time, and you shift from support to stress. Even before anything enters your system, your mouth reveals the principle. Baking soda appears in clinical dental products because its fine abrasive structure removes buildup, while its alkalinity limits acid-driven bacterial growth. Understanding this compound isn't about hype, it's about precision. And in the next section, we'll clearly identify who should never use baking soda and why chemistry never forgives ignorance.
While many commercial whitening products rely on aggressive chemical reactions to remove stains, baking soda works through controlled physical action. Its fine particles gently polish the enamel, lifting residue from coffee, tea, and food when used correctly, without intentionally damaging tooth structure. But whitening is only a secondary effect. The more important mechanism is chemical balance. The mouth naturally becomes acidic throughout the day. When acidity persists, it creates ideal conditions for bacteria linked to cavities, gum irritation, and persistent bad breath. Baking soda doesn't simply clean the surface. It helps shift the oral environment toward a more neutral pH, making it less supportive of harmful microbial activity. When oral pH drops too low, acid-tolerant bacteria gain the advantage. These organisms drive plaque formation and enamel erosion. By buffering excess acidity, baking soda disrupts the conditions they depend on. Clinical evidence supports this mechanism. Research published in the Journal of Clinical Dentistry has shown that toothpastes containing baking soda achieve greater plaque reduction than non-bicarbonate formulas. Additional studies report measurable decreases in oral bacterial levels following controlled use. That said, caution matters. Baking soda is mildly abrasive. Frequent or forceful application can weaken enamel over time. Dental professionals generally advise limited use, soft bristled brushes, and gentle pressure. Used sparingly, it can support oral hygiene without unnecessary risk. Now let's move deeper into the digestive system.
Heartburn and acid reflux occur when stomach acid escapes its normal boundaries and irritates the esophagus. Diet, physiology, and certain medical conditions can trigger this, but the core issue remains excess acidity. Sodium bicarbonate functions as a buffering compound. When dissolved in water, it can temporarily neutralize stomach acid through a straightforward chemical reaction.
Clinical reviews in gastroenterology and hepatology recognize it as a fast-acting antacid for occasional symptoms, not for chronic use. Finally, some challenges occur on the skin's surface. Certain fungi thrive in warm, acidic environments. By mildly raising surface pH, baking soda can make these areas less favorable for fungal growth when applied externally in controlled situations. This is not about shortcuts or cures. It is about understanding how small chemical shifts influence biological systems and why precision always matters.
This isn't folklore or hype. It's basic chemistry. In lab settings, sodium bicarbonate has been shown to inhibit the growth of some fungal strains by shifting surface pH. That matters because many fungi rely on specific pH conditions to thrive. For external support, a diluted foot soak or a light paste is sometimes used to reduce moisture-related irritation in areas like the feet. Results vary, and this is supportive care, not a substitute for proven antifungal treatment when infection is significant or persistent. Now, urinary discomfort. UTIs can cause urgency and burning that disrupt daily life. Antibiotics remain the primary treatment for confirmed infection. Baking soda is sometimes discussed because it can reduce acidity. Less acidic urine may temporarily ease burning for some people. However, symptom relief is not the same as eliminating bacteria. A small study reported symptom improvement in women with recurrent urinary discomfort under monitored sodium bicarbonate use. That does not mean it's safe for everyone or appropriate for self-treatment. If symptoms are severe, recurrent, or accompanied by fever, back pain, or blood in urine, seek medical care. The rule is simple. Chemistry can influence comfort, but dosage, frequency, and medical context decide whether it helps or harms. A critical clarification is necessary. This approach is supportive, not curative. Severe or persistent infections require medical treatment. However, as a cost-effective method to manage discomfort during recovery, it can play a limited role when used responsibly. Now let's return to the mouth, this time to a different source of pain: canker sores. These small oral ulcers are often triggered by stress, minor trauma, or dietary factors. Despite their size, they can make eating, drinking, and speaking uncomfortable. One reason they linger is the acidic environment of the mouth, which continuously irritates exposed tissue and slows healing. Sodium bicarbonate works by buffering that acidity. When used as a gentle mouth rinse, it helps restore a more neutral pH, reducing irritation and supporting the natural healing process. A simple rinse made with a small amount of baking soda dissolved in warm water is commonly used for this purpose. Clinical literature supports this mechanism. Reports published in the Journal of the American Dental Association indicate that sodium bicarbonate mouth rinses can reduce discomfort and support faster resolution in recurrent cases. Its mild antiseptic properties also help limit bacterial buildup around the affected area. Unlike stronger chemical products that may further irritate sensitive tissue, this method is generally well tolerated when used occasionally and correctly. As with any intervention, moderation matters, and persistent symptoms should always be evaluated by a healthcare professional. What if a simple compound could influence physical performance without relying on expensive supplements? At this point, we move from recovery to performance. For decades, sodium bicarbonate has been studied in sports science, not as a trend, but as a physiological buffering agent. During high-intensity exercise, muscle cells produce acid as a byproduct of energy metabolism. As acidity increases, muscle pH drops. This shift interferes with contraction and contributes to the familiar burning sensation that limits performance and accelerates fatigue. Sodium bicarbonate functions by buffering excess acid in the body. By moderating pH changes in muscle tissue, it can delay the physiological conditions associated with fatigue during short, intense efforts. This mechanism is well documented. A meta-analysis published in the Journal of Strength and Conditioning Research found that sodium bicarbonate supplementation improved performance in high-intensity, short-duration activities such as sprinting, swimming, and cycling. Participants were able to sustain peak output longer due to delayed fatigue. However, this approach is not universal. Improper dosing can cause gastrointestinal discomfort, and it is not appropriate for everyone. Any performance-related use should be approached cautiously and ideally under professional guidance. This is not about pushing past the body's limits blindly. It is about understanding how biochemical balance influences physical output, and why precision matters more than hype.
When used in performance contexts, sodium bicarbonate has been studied for its buffering effects on exercise-related acidity. Research indicates that gradual, carefully monitored intake may help delay fatigue during short, high-intensity efforts. However, sudden or excessive intake can cause gastrointestinal discomfort, which is why any use must be cautious and individualized. This is not a shortcut, and it is not appropriate for everyone. Now, let's shift to the body's filtration system, the kidneys. In chronic kidney disease, one major complication is metabolic acidosis, a condition in which impaired kidneys struggle to remove acid from the bloodstream. As acidity accumulates, it places additional strain on already vulnerable organs and can accelerate functional decline. Sodium bicarbonate has been examined in clinical settings for its ability to help buffer excess acid under medical supervision. A well-known study published in the Journal of the American Society of Nephrology observed that patients with advanced chronic kidney disease who received monitored bicarbonate therapy experienced a slower progression of kidney dysfunction compared to those who did not. The findings also suggested a reduced risk of reaching end-stage renal disease. This does not make sodium bicarbonate a self-directed solution. Individuals with heart conditions, high blood pressure, or fluid balance issues may be at increased risk due to sodium intake. Any therapeutic use must be guided by a healthcare professional. Finally, we turn to rheumatoid arthritis, a condition driven by immune-mediated inflammation that leads to joint stiffness and pain. Ongoing research continues to explore how systemic acid-base balance may influence inflammatory processes, reinforcing the importance of precision over experimentation. Modern medicine often manages inflammation through pharmaceutical intervention. However, research published in 2018 in the Journal of Immunology explored a different biological pathway involving sodium bicarbonate and immune signaling. The study examined how bicarbonate intake may influence immune cell behavior. Findings suggested a shift in immune response toward a less inflammatory state, observed across both human and animal models. Certain inflammatory markers were reduced, indicating a potential regulatory effect rather than suppression of immunity. This does not suggest a replacement for medical treatment, nor does it imply a universal solution. It highlights how systemic chemical balance can influence immune signaling under specific, controlled conditions. Taken together with earlier findings, from digestive acidity to muscular performance and kidney function, this research reinforces a broader principle. Small biochemical changes can have measurable physiological effects when applied carefully. The real question is not whether these mechanisms exist, but whether they are approached responsibly. Understanding how the body responds to pH balance allows for informed decisions
rather than assumptions. If this discussion offered a new perspective, consider following Health and Longevity Hub for evidence-based explorations of how biology, chemistry, and lifestyle intersect. Ongoing research continues to refine these insights, reminding us that progress in health often comes from understanding fundamentals, not shortcuts. Next, we turn to a different inflammatory condition that operates through a distinct mechanism: gout.
Gout often appears suddenly, commonly affecting the big toe, and is marked by intense pain and swelling. One contributing factor is elevated uric acid levels in the blood. When concentrations rise, uric acid can form microscopic crystals that irritate joint tissue and trigger inflammation. Managing gout typically focuses on controlling uric acid levels and reducing flare severity. From a chemical perspective, acidity plays a role in crystal formation. Substances that influence pH have therefore been explored as supportive measures alongside standard medical care. Sodium bicarbonate has been discussed in this context because of its alkalizing properties. By reducing acidity, it may help create conditions that are less favorable for uric acid crystallization. Some clinical observations suggest that alkalinizing agents can support the body's natural elimination of uric acid through the kidneys. This does not dissolve crystals instantly, nor does it replace prescribed treatment. Reports published in Arthritis and Rheumatism have noted symptom relief in certain patients when bicarbonate-based approaches were used during flare periods under medical supervision. These effects are associated with reduced discomfort rather than a cure. Because sodium intake can affect blood pressure and fluid balance, this approach should never be self-directed. Professional guidance is essential. As seasons change, another challenge becomes more common: colds and flu. Symptoms such as throat irritation, congestion, and difficulty breathing are often worsened by thick mucus and inflamed tissues. Alkaline solutions have been used in supportive care to help loosen mucus and soothe irritated areas. When used appropriately, such as in gargles or saline-style rinses, baking soda may help reduce throat discomfort and improve airflow by altering surface conditions. This is supportive care, not antiviral treatment, and persistent symptoms should always be medically evaluated. Gargling is one of the simplest supportive methods for throat irritation. Mixing a small amount of baking soda with warm water can help reduce surface acidity while soothing discomfort in the mouth and throat. Research discussed in the Journal of the American Dental Association shows that bicarbonate-based gargling can lower bacterial levels in the oral cavity. By improving surface conditions, this method may help limit microbial buildup and support comfort during mild throat irritation. It is gentle, inexpensive, and intended only for short-term supportive care, not as a treatment for infection. Similar principles apply when baking soda is used in saline-style nasal rinses. Adjusting surface pH may help loosen mucus and reduce irritation, making breathing more comfortable. This does not eliminate viruses, but it can support the body's natural clearing processes when used appropriately. Now we move to a more complex area of medical research. Some cancer studies have examined how acidic microenvironments influence tumor behavior. Because acidity can affect cellular processes, researchers have explored whether altering local pH may influence treatment response. Sodium bicarbonate has been studied in laboratory and early research settings for this purpose. This research does not indicate a cure and does not replace standard cancer therapies. It represents ongoing investigation into how chemical environments interact with biological systems, always under medical supervision. In 2009, a study published in Cancer Research
explored how acidity affects tumor behavior in laboratory models. In animal studies involving metastatic breast cancer, researchers observed that sodium bicarbonate reduced acidity in the tumor environment. This shift in pH was associated with reduced spread and improved sensitivity of cancer cells to chemotherapy. These findings do not suggest a cure, nor do they apply directly to human treatment. They represent early-stage research aimed at understanding how chemical environments influence cellular behavior. Any application beyond research settings requires strict medical supervision and should never replace established cancer therapies. This area of study highlights a broader scientific principle. Cellular activity is influenced by its surrounding conditions. Research continues to explore how modifying those conditions may complement conventional treatments in the future. Now, shifting from clinical research to daily hygiene. Body odor is largely produced when bacteria break down substances in sweat, particularly in acidic conditions. Baking soda has been used topically to absorb moisture and reduce surface acidity, making the skin less favorable for odor-causing bacteria.
Studies published in the Journal of Cosmetic Dermatology have reported reduced underarm odor following topical sodium bicarbonate use. For some individuals, especially those avoiding fragranced products, this offers a simple, low-cost alternative. However, sensitivity varies, and skin testing is always advised. Finally, safety matters. Baking soda is not suitable for everyone. Individuals with kidney disease, high blood pressure, or conditions affected by sodium intake should avoid unsupervised use. Those with sensitive digestive systems may experience irritation if stomach pH is altered. Understanding chemistry means respecting limits. From oral care to immune research, this compound illustrates how basic substances can interact with complex biology. Informed use, not experimentation, is what turns information into longevity. Welcome to Health and Longevity Hub. Stay informed, stay balanced.